Good evening and bienvenue. My name is Dr. Katharine Smart, and I will be your facilitator this evening, and I'm joining you tonight from Kelowna. Before starting, I'd like to acknowledge that I'm speaking to you from the traditional territories of the Okanagan and Syilx peoples. Their time here reaches back to time immemorial. Since we are participating tonight virtually from across the country, I'd like to acknowledge that many of us are calling in from various treaty lands and unceded territories. I was fortunate to serve as the president of the Canadian Medical Association from 2021 to 2022. And I can tell you it was absolutely an honor to serve the profession in that capacity. And I'm very much looking forward to hearing more from our candidates tonight on their vision for the CMA and our profession as we work through these challenging times together. Before we begin, I'd like to make note of a few housekeeping items. While most of the questions tonight will be asked in English, the candidates can choose to answer in the language of their choice. For this reason, simultaneous interpretation is available by clicking on the interpretation button in the meeting control panel at the bottom of your screen. You can select the language you'd like to hear, EN for English or FR for French. If you do not select an option, you will hear the comments in the language spoken. As a reminder to
Hi, everyone. I'm Tristan Leclaire, and I'm the Director of Community Engagement. I'm just jumping in as a backup for Dr. Smart until she's able to jump back on. So I'll just continue where she left off with the interpretation. So as she was saying, you can select the language of that you'd like to hear, EN for English or FR for French. If you do not select an option, you will hear comments in the language spoken. And as a reminder to everyone joining us, this session is being recorded. Oh, Dr. Smart, you're
I'm
back. So maybe
back.
I'll
I'm not
hand it
sure what
back to you.
happened there. So there we go, our first technical issue of the night.
Hi, everyone. Again, it's me, Tristan, so I'll just continue on. So just want to welcome everyone to the Meet the Candidates session for our upcoming CMA President-elect election. So I'll just provide a bit of information here. Every year, the president of the CMA is elected by members from a different province or territory based on an alphabetical rotation. This fall, it's New Brunswick's turn to elect a president for 2025-26. Any CMA member with a New Brunswick postal code is eligible to vote for the CMA president-elect between November 22nd to December 6th, 2023. The results of the election will be announced by December 8th on cma.ca. The elected nominee will be presented for general council approval at the AGM, which will move from August to May in 2024. With that, I'll hand it back to you, Dr. Smart.
All right, thank you, Tristan. I'm not quite sure what's going on with my Zoom tonight. So I think he told us about the AGM, and I talked about the candidates introducing themselves. So I think we're ready to jump into introductions. We're going to give each candidate 2 minutes to introduce themselves, and we'll be going in alphabetical order. So I will start with Dr. Margot Burnell.
Good evening, good afternoon, bonsoir, bon après-midi. I am Margot Burnell. I'm a medical oncologist in St. John, local chief of staff, Zone 2, Horizon Health Network, St. John area. I was born and raised in Windsor, Ontario. I obtained my medical undergrad and postgrad training, University of Western Ontario and U of T, respectively. I completed a fellowship here at the Royal Marsden, London, UK, before starting my practice in St. John over 3 decades ago. I truly hope one day there will be a cure for cancer, but until that time, I still enjoy going to work. I'm motivated by the science, the academia, and challenges in my field, but equally important by the desire to enable each patient's journey to be the best it can be. I have been involved with local and provincial medical societies, having chaired Healthcare and Promotion Committee for MBMS, representing New Brunswick on the CMA Committee of Healthcare. Why am I putting my name forward? I am acutely aware the healthcare system is broken. Each and every one of us face huge challenges day to day in trying to provide the best care to our patients, families, and communities. I have witnessed these challenges through the lens of the provider, department head, local chief of staff, and family member. The challenges known to all of us: high expectations of patients and loved ones, lack of access to primary care specialty providers, demographics of an aging population, overcrowded emergency departments, increasing number of alternate level of care patients, increased homelessness, and huge advances in technology. This leads to long days, burnout, and disengagement. I am focused on the vision state-of-the-art healthcare system, scientifically, financially sound, responsive to patient communities' needs and goals, delivered by a healthy, vibrant healthcare team. There is great opportunity through CMA partnering with you, learners, provincial and territorial medical societies to enable and influence change, to bring your voice, your solution, your thoughts to the table. CMA and we, the membership, shall rise to the challenge.
Thank you, Dr. Burnell. And now over to you, Dr. Russ.
Bonsoir à tout le monde. Bienvenue.
Hello, and good evening, everyone.
I am originally from Bathurst, New Brunswick. I went to med school at Memorial University in Newfoundland, and I did my family residency at Dalhousie University. And after that, I worked in the military for 5 years, and then I worked in mental health and addictions, and as well as a hospitalist, as well as doing locums for family medicine, for family physicians. And then I went into public health. And what's really interesting about what's happening right now with the CMA and Impact 2040 is this intersection between all of the things on the continuum of healthcare, the healthcare system, the health of the population, and the health of the workforce. And in terms of what I've seen in my career and the experience of the pandemic and working in public health at the policy level, I can see great opportunities ahead of us for trying to solve a lot of the problems that are really impacting healthcare, physicians, and patients and population health at the moment. So the idea of having social determinants of health, equity being priorities and things that we can focus on to improve not only the healthcare system, but the health of the population is really exciting. The health workforce challenges in terms of recruiting and retention, but also the work environment and the mental health of healthcare workers. Speaking with some members recently, it's really glaring and obvious that the challenges of trying to deliver healthcare services while trying to maintain your own well-being as physicians is very challenging. And hearing from physicians who have had struggles with chronic diseases and acute surgery types of situations, and then having to deliver care when they themselves don't feel like they're able to. So all of these things are critical to our collective success, and I'm really excited to be part of the solution.
Thank you, Dr. Russell. We're now going to move into our question and answer period with the candidates. So I'd just like to remind everyone on the webinar that we've opened the Q&A button. At any time, you can type in your question and click submit. We're going to vary the order that the candidates will answer the questions while giving each candidate the opportunity to answer each question. And each candidate will have 2 minutes for each question that's posed. So again, we are going to be using that Q&A feature, and we're going to allow you to upvote the questions that you see there, and the ones that get upvoted are the questions that I'll be asking to the candidates. We'd like to remind everyone to support a respectful, professional, and collaborative discussion. Questions that are discriminatory, defamatory, abusive, or offensive, or that violate privacy or confidentiality will not be addressed. As an exceptional measure, any participant who repeatedly submits inappropriate questions may be removed from the meeting. So we're going to start tonight with a question that was shared with the candidates ahead of tonight's event. We've been working with the New Brunswick Medical Society to promote this session and enable members to learn more about the candidates for president-elect. So I'd like to welcome a special guest, Dr. Paula Keating, who's the president of the New Brunswick Medical Society, and she's going to ask our first question this evening, and each candidate will have 2 minutes to answer. Thank you, Dr. Keating.
Good evening, and thank you. I'd like to ask both of you, how do you envision addressing the national human health resource shortages in the upcoming 3 to 5 years? Thank you.
Thank you, Dr. Keating, and Dr. Russell, we'll start with you.
So it's definitely a multi-sectoral problem. So there would be many levels of engagement in terms of stakeholders, whether it's the people who are funding positions, recruiting for positions, but also the workforce environment in terms of making sure that the environment that healthcare workers are working in is safe and appropriate in terms of what is needed for support. So I think the stakeholders would include government, policymakers, but also the healthcare system as well. And knowing that with recruiting and retention, there are ethical issues around recruiting from other countries, and then the types of things that need to happen in terms of making sure that there's a process for recognizing those workers in terms of their credentials, and making sure that that's something that can be done in a timely way. I can't see the timer, actually.
You have 1 minute left if you have more you'd like to say.
Oh, okay. Okay. Yeah. I just couldn't see the timer. So all of those conversations are really important to have at the different levels, at the federal level, but also at the provincial level. So relationship building is really important, and being able to communicate the issues very clearly, and making sure that there's engagement with the members of each province in terms of making sure that their voices are being heard and their concerns are being recognized and put forward in these conversations. And that's it.
Thank you, Dr. Russell. Over to you, Dr. Burnell.
Thank you, Dr. Keating. So I would approach this from the 3 points of view: retention, scope of practice, and recruitment. So I think it's really important that we retain those individuals that we have with a positive work environment, that every member of the team feels valued. They get appropriate remuneration, but that's really only one component. Job satisfaction is critically important. Suggestions and concerns must be heard and valued, and suggestions for practice changes and efficiencies are welcome in a supportive environment. We need to develop and implement strategies that mitigate and minimize burnout and disengagement, and encourage involvement in areas of medicine that energize them as part of their day. With respect to scope of practice, for all members of the healthcare team, I think they need to work to their full scope: registered nurses, LPNs, PSW, and all of our allied health members. With respect to physicians, I think we need physician extenders and opportunities to explore the rollout of physician assistants, increasing nurse practitioners in many of our clinical settings. Physicians get the most satisfaction, I think, when they interact with patients, help make a diagnosis, establish a treatment plan, and utilize their full CAN-Med competencies: expert, counselor, advocate, and advisor. The other major areas to decrease administrative burden and to offer turnkey offices and practices. Finally, with respect to recruitment, we need to train locally, both undergrad and postgrad learners. We need to increase enrollment in our medical schools and allied health professions. We need to offer return of service agreements for financial support. We need to recognize allied health professionals from other countries with defined accredited sites or countries with minimal barriers to practice in our country when they choose. And we need to provide tools and technology in the team environment that many have worked in during their training when they come to New Brunswick.
Thank you,
Thank
Dr. Burnell. We're now going to move to questions from the audience. If you have a question for the candidates, please submit it using the Q&A button. As a reminder, the questions we've received in advance have already been entered into the Q&A and are available for upvoting. I will now ask our staff moderator for the most upvoted question, which I'll read to the candidates. Okay, so our first question is, what information do the candidates believe needs to be shared around long COVID with the physicians across the country? So Dr. Burnell, we'll start with you.
So COVID provided a unique challenge for Canada and for much of the world. I think it identified areas of strength and areas of weakness within our public healthcare system. I think we responded to those areas and concerns as best as we could with the leadership of public health consultants and certainly Dr. Russell within our province, and we're grateful. But we also worked very hard within our own institutions. So I think we do need to look very hard about what we've accomplished, and then to understand both the acute and long-term side effects of long COVID. There are several studies being undertaken, and I think we need to share that information. We need to share the data. We need to share possible solutions. We need to recognize it as an illness and how best to manage it. So I think as much information as you can put forward with respect to that will be gratefully helpful for patients and for physicians dealing with their conditions. Many of these seem to be multi-system, multifactorial, and we need to get all of our community back to being as healthy and to function at their best.
Thank you, Dr. Burnell. Dr. Russell?
Thank you, Dr. Burnell, for all the work that you have done also in this field. So I really think that with long COVID, the information that needs to be shared with physicians is the research that is being collecting the data provincially and federally over the longer term. I think in the shorter term, trying to, again, do as much as we can on the prevention side with respect to making sure people are vaccinated and getting boosters, and education and awareness on that side is really important. And then on the other side is those people who have long COVID symptoms, making sure they have the treatment they need and the support for their symptoms moving forward. I think the other piece around COVID that I think has shone a light on the resilience or lack thereof in different demographics and different populations is that, and we can use this as an opportunity moving forward, is to, going into a crisis, because we don't know what the next crisis is going to be. It could be a climate change crisis or another pandemic, that making sure that our populations are as healthy and resilient as possible going into those types of situations is really important. So whatever upstream prevention can be done, whatever preventative aspects we can do ahead of time to build up our those protective factors moving forward, I think are very important. Making sure that physicians are empowered and patients are empowered with as much information around how that happens, but also at the policy level with stakeholders and policymakers. Thank you.
Thank you, Dr. Russell. We'll move to our next question, which will be placed in the chat again. Okay, question number 3. And this was received in advance. We all know that the primary healthcare system cannot continue as it is. Do you believe that the role of the family physician should remain as it is, or should that role be completely reconfigured within a team-based service with far more delegation of physician duties to other healthcare professionals? And Dr. Russell, we'll start with you this time.
Thank you, Dr. Smart. So family physicians are in an extremely tough position right now, and I do hear about family physicians who want to leave their practices, want to leave the type of medicine that they're practicing right now for something that is more sustainable with respect to their mental and physical well-being because of the burden of the workload. And obviously, if family medicine is going to continue, there will have to be some changes and improvements in terms of the quality of work-life balance. And if that comes in the form of delegating, being able to delegate, great, that would be excellent. I think we've also seen things like previously we've seen things like scope creep in other professions, which was not a welcome thing before. However, knowing that the strains on the system are so extreme that we have to be open to some of these things. However, some of these things are done without monitoring the outcomes and monitoring whether or not they're actually solving the problems they're designed to solve, or whether they're actually creating more problems than they've created than they're trying to solve in the first place. So with any of the solutions that are proposed, with any of these things moving forward, they do have to be monitored for whether or not they're actually improving the situation or in fact causing new problems that have to be addressed. So I think that creativity and flexibility right now with the healthcare system and policymakers and decision makers in the system, I think those conversations are extremely important, because otherwise I think there will be more and more family doctors who will not be satisfied with that lifestyle and with their current style of practice and profession.
Thank you, Dr. Russell. Dr. Burnell?
Thank you. So I think that family practice is at a bit of a crossroads, and I think the people best able to answer the questions are the family practitioners themselves. I think we need to seek their input. I think we all recognize that family doctors being in solo practice in an age of increasing technology, increasing demands, increased knowledge growth is probably not sustainable nor provide the best care. So going forward, exploring other models of care and shared care, I think is critically important. I would echo what Dr. Russell said, that there had been concern about professions practicing to their full scope, but I think we now realize the benefit that they can play and the importance they can help with patients in managing many of their symptoms. I still feel that family doctors are very important in coordinating the team and bringing all of the feedback to one individual and one sort of center to explain what multiple consultants have done and help them to navigate that. But I think we do need physician extenders and using all of our allied health professionals to deal with many of the problems. Not all of them are medical. Many of them revolve around social determinants of health, where having a social worker associated with a practice could be critically important. So I think we will see different models. I think learners are going to be exposed to different models, and they will certainly choose the model that they're comfortable with, and that gives them flexibility in their practice, gives them pleasure in their practice, gives them work-life balance, but offers safe and competent and patient-focused care.
Thank you, Dr. Burnell. We'll now move to the next upvoted question, which will appear momentarily in the chat. What is your experience with the interface of health and climate change? What challenges do you foresee within your term as CMA president should you win this election? Dr. Burnell, we'll start with you.
So health and climate change, I think, are critically important. We've seen across the continent that high temperatures or very cold temperatures influence health, influence mortality, influence illness. So I think health interacts with the social determinant, or climate change interacts with the social determinants of health, and that there is a focus in the CMA 2040 plan to explore some opportunities and challenges related to that. What challenges do you foresee as a term as CMA president? I think it's really to engage all of you, to encourage you to get back on committees, to put your voice forward, and to state what you really want to happen as you go forward in your practice, what you're willing to do, what are the critical features for you, and what's best for both not only you, but also for your patients.
Thank you, Dr. Burnell. Dr. Russell?
So with respect to climate change and health right now, we know, I do agree with Dr. Burnell about the social determinants of health in that regard, that the people that are most vulnerable for any bad outcomes with respect to their health are also the same people that are more vulnerable to climate change impacts. There is a lot of the climate change crises that we've seen recently are all surrounding fires and having to be evacuated. The trauma of those types of situations on people's mental health is something that takes a long time to recover from. We knew that from the Fort McMurray fires several years ago, that it took almost 2 years for all of the mental health recovery to even be able to supply the mental health services for folks that needed that. So I think for the healthcare system, understanding that the healthiest, the greenest hospital that you can build is the one you don't actually have to build. So I think when you're looking at climate change from that perspective, you know, what are the aspects of the healthcare system that can become greener? What are the aspects of climate change that are going to be impacting how medicine is practiced, but also how it's impacting our patients? And being prepared again with that resiliency piece and making sure that in advance of these things that we're prepared in terms of making sure that we're as healthy as possible. The
the risks in terms of medically, vector-borne illnesses will be increasing as temperatures increase. The food security will be impacted, and several big components like that. So I think, again, I'm glad they're in the Impact 2040 strategy, because they're really important to be addressed.
Thank you, Dr. Russell. We'll move to our next question. How can we train more Canadian students in our medical schools to address the Canadian physician supply issue? Start with you, Dr. Russell.
So I think right now, we obviously have a supply problem. So I think all across Canada, regardless of where you're going to medical school within the country, we're not meeting the demand across the country for physicians. How can we better improve that? Whether it's increasing seats across the country, or whether it's increasing how many international graduates we allow into the residency programs, and whether the number of residency programs are actually enough as well. So I think those conversations have to be had with medical schools across the country, as well as the College of Physicians and Surgeons, as well as the College of Family Physicians. So to see what the options are that are not already being implemented. I think there are lots of programs that are really existing right now. What can be added to that? Again, I think those things are really important to be explored. I don't know. I don't think it's a matter of trying to encourage more people to go into medicine if there's not enough spots for them to go into. So again, I think it's a supply and demand issue right now.
Thank you, Dr. Russell. Dr. Burnell?
Thank you. So I think it will require a dialogue with universities, medical schools, and the bodies that supervise learner and residents to increase the number of spaces for candidates and students. We've always been afraid of overtraining numbers of individuals and not having enough jobs for them or positions to go to. But medicine's going to become more complicated and more complex. So I think we need really to abandon that idea and really to assess what number we need going forward, and then to really work to get those slots for those individuals. Many Canadians go offshore or to the US or to other sites to train. And I think if we are able to accommodate them within our system, then we should do that, and we should encourage them to come back, because those that train within our location are more likely to stay. And I think we do need to make sure that the residency slots balance the primary care slots or the undergrad slots, so that we have the right proportion and that we are able to train locally, because that's how we will provide a sustainable workforce going forward.
Thank you, Dr. Burnell. We'll move to our next question. What are your thoughts on the impacts on physicians of working long hours, brackets over 16 hours at a time, given the recent CMA physician survey indicating increasing rates of burnout, depression, and suicidal ideation? So Dr. Burnell, we'll start with you.
So I think this is a very disturbing fact and a concern for all of us, both for physicians themselves as individuals and members of their families and communities, but also for the care of patients when they're working long hours. So I think there will need to be a greater emphasis in understanding how to address that, how to either restrict hours or how to modify those hours so that patients get the best care. So physicians need to have appropriate rest, they need to have appropriate time for other activities, and they need to do things in medicine that may not be clinically oriented or clinical care day in and day out, to encourage them to be energized and to get benefit from that. Ultimately, I think we will need to have more physicians working, because the need is there, and medicine, unfortunately, is 24/7, 365 days a year. So to have a more balanced work-life balance and to address the concerns, I think we're going to need more people. And many of the specialties have gone to days off after being on call, or they've gone to shift-like structure so that physicians are coming in fresh to address their patients' needs and concerns. This will require dialogue because the responsibilities don't go away, the concerns don't go away, the financial considerations for all of this are also prominent and will need to be thoroughly discussed.
Thank you, Dr. Burnell. Dr. Russell?
So very, very concerning statistics in terms of safety in the workplace and for well-being and mental health. I think it starts with a cultural shift and a change at the leadership level. Number one, and number two, to have that commitment to provide a safe working environment, safe working conditions, including the number of hours that are worked. If you're already down the path of becoming burned out and depressed, the stigma surrounding seeking mental health resources and support really need to be, the barriers to that need to be decreased, and there has to be a more open conversation about people's mental health and what it is they need to support their mental health and well-being. And again, I think that's also a cultural aspect. I think the more people that talk about it and demonstrate it and model it, it means that as mentors, as leaders, the next generation of physicians coming up who are being trained will be able to adopt that same type of behavior because it definitely is something that needs to be modeled for it to be accepted. Because again, the stigma and the fear of repercussions on their career, but also the standards that we hold ourselves to in terms of how to support our colleagues. I know that physicians don't want to let their colleagues down by not being there, and needing to take time off means a burden to other of their colleagues. And so I agree with Dr. Burnell around having more physicians to be able to do the work so that you are spreading it around so that the physicians who are doing the work can do it in a safer, healthier way, which is safer and healthier for their patients.
Great. Thank you, Dr. Russell. Move to our next question. So this is another question that was received in advance that's been upvoted. Which of you will insist that the CMA use its windfall profit from the sale of MD management to offer substantial tuition support for medical students across Canada? Many medical students graduate from medical school with hundreds of thousands of dollars in debt, a major deterrent in choosing family practice, geriatrics, or pediatrics as a career. Dr. Russell, we'll start with you.
So in the Impact 2020 document, it does talk about the different ways that CMA can advocate for better healthcare and health services and health work environments, including funding. So the funding sources that the CMA has available to it right now, obviously there are many options for how to use that. And so I believe that that could be something that can be discussed in that context, that what are the different options for funding and how can it be used to improve the workforce, the work environment, and the system. So with that funding comes the opportunities to have those conversations and prioritize where the funds will go. And definitely, I personally had the good fortune of being funded by the military, so I didn't have the same challenges, and I'm not sure again what the types of opportunities are being offered within each province in terms of return for service, but that in combination with having conversations about how funding can be used for students with a lot of debt moving forward, I think would be something that could definitely be included in those conversations.
Thank you, Dr. Russell. Dr. Burnell?
Sorry, my mouse decided to go for a walk. So I think this question is very interesting. We recognize that learners are coming out with a huge amount of debt, and it is I think, coloring their opportunities and influencing their decisions. I think that it will require discussion around the CMA board to get all of the views with respect to that, how to make that better for students, how it will encourage learners to stay in the profession. And I think it probably needs to be tied with return of service or commitment to staying within the country and practicing for a period of time. I think we're fortunate in New Brunswick, and just a shout out to the Medical Education Fund because they have worked very hard to provide bursaries and scholarships for many of our learners to help lessen the burden. It doesn't decrease it completely, but I think it is in recognition of the burden that students face in pursuing this career. I think we'll just need to see what all of the demands are for the financial dollars at the CMA table, but I'm certainly willing to bring it forward for discussion so that people do not come out with huge debt wherever possible.
Thank you, Dr. Burnell. We'll move to our next question. The CMA is a large pan-Canadian organization. How do you see Quebec and Canada's French-speaking physicians being included at their fair value, representing over 25% of Canada's physicians? We feel left out, having no local office represent us. Dr. Burnell, start with you.
So I think it's very important that all provinces and territories are involved and feel part of the CMA and would welcome that. I think our programs are open across the country, and we would endeavor to include you and ask for your voice to be brought forward for your concerns. We do have a representative that represents us as CMA president in Quebec, I understand, to help at least with translation and present some of those concerns. You're a critical voice. You have lots of physicians, and your needs are not dissimilar to the rest of Canada. So I think in bringing our concerns forward to our multiple stakeholders, our multiple forums, that your voice needs to be included, recognized, and that we're there to hear all of the voices and to hear if there are differences and concerns, and then to decide on what our common goal and vision is that we can all support. And I think being united is critical in establishing that.
Thank you, Dr. Burnell. Dr. Russell?
Oui, alors moi, je
then
n'étais pas au courant qu'il n'y avait pas de
I did not know that there was no representation within Quebec for CMA, but I agree with Dr. Burnell that it is very important that we get all information concerning any problems that might be different and unique to the province of Quebec, as well as other provinces. It's important to communicate and to be part of a united group in order to carry out this conversation. If you feel that you are not truly part of this group because of the language issue, that might mean that we need to engage in other conversations to determine what it is we're not doing right now and what it is we can improve. And what it is that we should be aiming at in order to be able to improve the situation. We must, of course, be united as an association, and if there are any barriers, we need to be able to address them and make sure that we change or improve any challenges, and we must do this together.
Thank you, Dr. Russell. I believe we have time for one more question, so we'll go to that. Okay, so the final question, The present Minister of Veteran Affairs, Jeanette Pepapas Taylor, is from New Brunswick. What role, if any, do you see the CMA having as the national voice of physicians to work with the federal government to better identify and address the needs of veterans, both as patients in general, but also for the growing number of doctors and CMA members that are themselves veterans? We'll start with you, Dr. Russell.
So I did spend part of my career working for Veterans Affairs. I myself was spent 10 years in the Canadian Forces, so I do understand the need to make sure that those issues are addressed at the federal level, in particular for our members. So finding out exactly what the gaps are in whatever service and supports are provided currently, and then seeing who and where the conversations need to take place with respect to how to make improvements. When I worked for Veterans Affairs, my job was to assess injuries, to provide pensions. And when I was in the military, obviously knowing that you could be discharged medically, and there was going to be you could be suffering from something for the rest of your life. And with those challenges in the longer term, and making sure that there are supports not just for the mental health challenges and PTSD, et cetera, but the physical challenges as well. So I think it's really important to make sure that the voices of those members are heard for themselves and for members who have patients who are veterans.
Thank you, Dr. Russell. Dr. Burnell?
So I think we owe a debt of gratitude to the veterans that have served our country. And so I think we need and recognize their service and owe them a debt of gratitude. And therefore, we need to understand their concerns, their needs, their gaps in care. The face of war has changed over decades and has been, I think, more stressful, and the needs and concerns of veterans, I think, are being voiced much better than they did in previous generations. And so their suffering, their psychological distress, their interactions with their families, disruption to families and life, I think are really just coming to the fore. And we therefore need to understand their experience, listen to their experience, and take their suggestions on how best to provide for them. Becomes even more critical for our own profession to help them work through the concerns and struggles that they have, because it is another layer of complexity that many of us will never understand, but are there to hear, listen, and support them, and to make sure that they can fulfill and feel fulfilled in whatever role they want to do within the profession going forward. I think they have a lot to bring and to give back, but we need to make sure that they're healthy and strong to do that.
Thank you, Dr. Burnell. We'll now move to the closing comments from each of our candidates. Each person will have 2 minutes to close out. So Dr. Burnell, we'll start with you. Thank you.
So thank you, Dr. Smart. Thank you to all the participants for your engagement and your thought-provoking questions. Passion for medicine and pride in the profession. I think we've seen the practice of medicine is rapidly changing. Healthcare systems are under stress. Health workforce is struggling, and we're at an all-time low. We're tired, we're burnt out, we're overburdened, but we must rise to the challenge. So we seek and encourage your engagement and involvement. We must foster experimentation and innovation. We must be prepared to fail at times. We must seek opportunities to engage and educate and inform all of our stakeholders, communities, patients, our colleagues, our teams, our regulatory bodies, and our funders, because solutions can only truly be found as a collective. We must prioritize what is most important to our patients, but also to ourselves. We must be open-minded to new delivery models and funding models, as alluded to in these discussions. We need to care for each other as individuals and value our profession. We must celebrate positive step forwards, however small. And this, I think, will restore our passion and our pride in our profession. We've referenced the CMA Strategic Plan 2040, and this truly does provide a foundation for advocacy, influence, enablement in all three spheres, many of which you've heard tonight: health, health system, and health workforce. I would like to leave you with this thought. As Franklin Roosevelt once said, there are many ways of going forward, but only one way of standing still. Thank you.
Thank you, Dr. Burnell. Dr. Russell?
Thank you, everybody, for being here tonight and sharing your questions with us. I mentioned earlier that I have a passion for upstream prevention, and I love the fact that the Impact 2040 has this intersection with the continuum of the health system with the health of our patients, as well as the health of the workforce. So being able to work with those three areas, with stakeholders, with policymakers, with members, with the healthcare system, in all of the areas that can help improve, whether it's the climate change piece, whether it's the mental health for physicians, whether it's the social determinants of health and housing, and it's just really phenomenal to have this opportunity right now with how far the CMA has come with respect to moving the bar much higher than it has ever been in terms of what we can see in the future to be able to accomplish together. It's an exciting time to be able to be innovative and creative with the solutions. And I think that energy that we need and the momentum that has been created and generated by the CMA for this advocacy piece is so important, and to have that enthusiasm of the members behind us is really important and necessary, and again, to continue to have those voices of the members to contribute to all of these solutions moving forward. And it's just a really exciting time to be able to have these conversations.
Thank you, Dr. Russell. I want to take this opportunity for a huge thanks to both our candidates tonight, Dr. Burnell and Dr. Russell, for sharing their passion and commitment to the health workforce, the health system, and the health of the population, as well as answering all the variety of questions tonight. I want to thank all of you who joined us tonight. We really appreciate your time and your interest in this very important election. So what happens next? The election period will open for CMA members with a New Brunswick postal code on November 22nd, and it will run from November 22nd to December 6th. All eligible CMA members will receive an email with instructions on November 22nd. Remember, if you wish to vote, please renew your CMA membership by November 20th. The results of the election will be declared on the website cma.ca on December the 8th. The elected nominee will then be put forward for approval by CMA General Counsel at the annual general meeting, which will be on May 29th, 2024. So again, just a reminder that the AGM is moving to May from August. As a special note, we are also seeking to fill 2024 vacancies for positions on the CMA Board of Directors, the Vice Chair of the Annual General Meeting, as well as various committees. For details, please visit www.cma.ca/CMA-nominations. So again, that's cma.ca/CMA-nominations. The deadline to apply is December 29th. So that brings us to conclude our evening tonight. We will be sending you a post-event survey shortly, so please let us know what you thought of the evening, and we really value your feedback so we can continue to work on making these events useful for you as members. I want to thank again everyone for joining us tonight. Again, special thanks to Dr. Burnell and Dr. Russell. Merci. Good night.